4 ways to get rid of bunions and corns. Bunions and corns can appear on the feet for a variety of reasons. While they're not usually dangerous, they can cause physical discomfort, insecurity, and problems with self-esteem. Read on to find out more about this problem and learn the most effective and appropriate solutions according to your needs. Bunions and corns are protuberances either of bone or skin that appear for a variety of reasons, ranging from genetic factors to poor choice in footwear. These lumps are harmless most of the time. Keep in mind, however, that in the following cases you will require the attention of a specialist. Patients with diabetes, inflammation or increased temperature in the area around the bunion, bleeding, difficulty walking, bone protrusions. How can you distinguish between bone or skin protrusions? Knowing which type of protrusion you have is really important because your treatment will depending on this distinction. Bone protrusions are usually hard to the touch and appear in the joints, the most common one being the big toe. This is known as a classic bunion. The treatment to correct these includes using special pads and braces, as well as orthopedic shoes and splints. Before you start any corrective processes, it's important to have the diagnosis and recommendations from a specialist. On the other hand, a protrusion can appear in places where you've had constant friction between your skin and another item, such as a shoe. These are known as corns, which are thickened skin that's usually found on the top or the sides of the toes, as well as the bottom of your feet. They can be eliminated without difficulty with some simple methods. Today, we want to share 4 great options that you can choose from for treating bunions and corns on the feet. Treatments for bunions and corns. The acetylsalicylic acid found in aspirin is used in dermatology for its anti-inflammatory properties and to help fight acne. It's also the active ingredient in many of the patches that are available on the market for corns. In this instance, it will be combined with the antiseptic properties of lemon juice. Ingredients: 5 or 6 aspirin tablets. The juice from 1 lemon. What should you do? Crush 5 or 6 aspirin tablets into a powder and add the lemon juice until a paste is formed. Apply this mixture to the affected area and cover it with gauze and a plastic bag for 10 minutes. Rinse after the indicated time has passed. Repeat this every day for 1 or 2 weeks. Apple cider vinegar has very powerful antiseptic properties that help soften hardened skin. Ingredients: 1 1 slice of bread, 1/2 cup of apple cider vinegar, 125 milliliters. What should you do? For this simple but effective treatment, soak a small slice of bread in apple cider vinegar. Wash your feet with warm water and place the moistened bread over the corn. Affix it to the area with some gauze and medical tape. Allow this remedy to work overnight. Repeat every night until you get results. Pumice stone and Epsom salts. Ingredients: 3 tablespoons of Epsom salts, 30 grams, water, as much as you need. Utensils: a bucket, a pumice stone. What should you do? Soak your feet in a bucket of warm water and Epsom salts for 10 minutes. After that time, rub them with the pumice stone for 2 minutes, taking care not to harm the skin. It's important to apply this treatment every day and stop if your protrusion starts to bleed or hurt. Aloe vera. To use aloe vera, all you need to do is cut a leaf in two and scrape the gel from the plant. Apply it to the affected area and leave it on overnight. Soon, you'll see that your corn disappears. Tips to prevent their reappearance. Remember that your feet work hard every day, so you should pamper them by choosing comfortable shoes that fit properly and don't pinch. Don't wear high heels, as problems such as bunions can arise from them. Avoid footwear with a narrow forefoot that can prevent your toes from resting comfortably, which leads to the formation of corns. Use pads and extra support in your shoes, along with protectors for the joints of your big toe.